safe and secure environment for the president and for the presidential candidates. We are excited for campaigns to see the very best of Nashville at one of our premier universities, Belmont. So we're excited about that. There is also other significant, tremendous economic news out of our state today. General Motors has announced the single largest expansion financial investment in our state's history. They are announcing an investment of $2 billion in our Spring Hill plant with General Motors. This expansion is significant in that it is the largest ever, but it's also a continuing partnership with General Motors that's been a great partner to our state and provided thousands of jobs for decades in Tennessee, and we're grateful for their continued investment here. This investment is specifically for the manufacture of electric vehicles, and it's important because it helps solidify really the leading role that Tennessee has in the nation in the production of electric vehicles. So that's welcome news, and we're grateful for the investment by General Motors. Dr. Piercy's on the line, and she'll give a more detailed briefing in a minute, but I'll start with sort of top-line health update comments. Today, the Department of Health launched a new website for COVID-19. It is designed to improve the flow of information. It's a simple way for Tennesseans to think through all aspects of COVID-19, easy to understand. It's searchable by county, so people will have more detailed information, clearer information at the local level, and we encourage Tennesseans to use this tool to help make informed decisions about what's happening in their own local community. We've also launched a new PSA campaign today that really is centered around choosing when you decide to go about your daily activities, choosing to wear a mask. We know that most people are, in fact, engaging in activities outside of the house, and we want to make sure that we have the safest outcomes there. And the most readily available resource for that is wearing a mask. So our Choices PSA reminds Tennesseans that we all have choices to make that either help or hurt our efforts to mitigate the spread of the virus. And masks are one of the many tools outside of social distancing and other tools. And this PSA campaign will highlight that. So be looking out for this new campaign. And speaking of masks, I also had a call with county mayors across the state and relayed to them that I intend to extend their ability and their authority to put in place mask requirements through the end of the year in their individual counties. Mayors have been excellent partners, and I am encouraging them to use the tools that are in their toolbox to make sure that their response is appropriate to what's happening in their community and their folks are safe. On the state side, we have worked to build out an infrastructure, targeted response infrastructure over the last 8 months. And we've seen the ebb and flow of cases over the months, and we're seeing that happening across the country. And particularly, we have a rise in rural cases in our rural counties. And so this infrastructure allows us to really lean into different targeted approaches, whether it's additional funding for hospital staffing, which we're doing now to make sure that we have sufficient healthcare staff, working with our partner providers to provide them funding for additional staffing, amping up our COVID-19 specific nursing homes to make sure that we reduce the load on hospitals of nursing home patients that are low acuity and don't need to be in the hospital, but don't need to be back in a nursing home. So that portion of our infrastructure is now in place, and that's another example of what we can be doing as we see this ebb and flow of cases. And another thing we're doing this week, we will be announcing the resurgence of weekend pop-up testing sites throughout rural counties across Tennessee, especially those counties that are seeing a significant rise in case load. We'll be sharing the dates and the locations later this week on those pop-up testing sites. And I just want to remind Tennesseans and urge them, when in doubt, get a test. And that's in every community in our state. We know that testing is another significant tool that we can use to fight the spread. We know when the greater amount of testing we have, the more folks we know that are infected, and the ability to contact trace and mitigate spread is particularly helpful. So you'll see a number of these things coming online, or we're strengthening that infrastructure. That response infrastructure will continue to evolve throughout the end of the year. Part of that as well includes preparing for a safe, approved vaccine to come online. And Dr. Piercy will have more to say about that, but we have submitted our first round of draft planning for COVID-19 vaccine distribution to the CDC. We did that just this week, and there are many aspects to planning for vaccine distribution. Our primary goal is to get the infrastructure in place to make sure that when we do have a vaccine that is safe and approved, that we have a distribution model that can run as smoothly as possible. We will continue to talk about this more in the days ahead, because we know that the vaccine situation is extremely fluid, and so the plan will likely be fluid as well, depending on what happens with vaccine development. But we are awaiting a safe, approved vaccine, and then we will be prepared to distribute it. Dr. Piercy, why don't you come on the call and add comments to that vaccine distribution and in any other parts of your health report?
Thank you, Governor. Good afternoon, everyone. I'll get to vaccines in just a moment, but I also first wanted to echo what the governor said about the ebb and flow of cases. We have seen slight increases in our case rate and positivity rate, but the thing that has really caught our attention is the dramatic rise in hospitalizations. Those hospitalization numbers are now up over 50% since October 1st. And that is primarily because of exactly a point the governor made, in so much that most of our cases now are coming from rural areas. You've heard me say it before, but I will remind you. As a general principle, our rural populations have more concentrations of older and sicker individuals who are more likely to need hospitalization if they become ill. But we are encouraged that people continue to do the right things. We encourage them to double down on washing your hands, wearing your mask, and watching your distance. And I also want to echo a few of the things that we're doing to help mitigate that rise in hospitalizations. In addition to those personal responsibility actions that I just mentioned, we're working with our hospital partners who are infinitely better prepared now than they were several months ago, certainly better prepared than they were in March and April, and even a good bit more prepared on how to handle capacity as well as how to clinically treat cases than they were in July and August. So again, the COVID-specific nursing facilities are allowing a pop-off valve, if you will, for hospitals, as well as the hospital staffing assistance grants. And then as a reminder, our alternative care sites continue to exercise and prepare in the catastrophic event we would need to open one of those. As the governor mentioned, we did submit our plan to the CDC on Friday for our initial draft of the vaccination distribution program. There are still a lot of uncertainties when it comes to that. And so you will see, when you see it posted, and we're going to release that tomorrow, you will see it marked as draft. I think the most important thing to realize here is that this is a working, living, breathing document. It will change, it will morph as we get more information. But as the governor mentioned, what we do know is we know that there's going to be a significant infrastructure build out requirement, basically the how. We're not exactly clear on all of the details yet on the who and the what. We don't know exactly which vaccine. We don't have all of the guidance yet from our federal partners on who is going to get it, but we do know how we can do it when we have that ready. So I think you'll be getting notice that we're going to do a deeper dive into that tomorrow. as well as release the draft. And so be watching for those details, and we'll give you more information and answer questions about our vaccine plan tomorrow. I do have one particular item to draw your attention to today, and I will give the disclaimer. It's a little bit detailed, and so I'll try to go through it slowly, and happy to answer questions afterwards if some part of it needs to be clarified. But we are adding a new detail to our reporting starting tomorrow. This is nothing particularly different or novel, but it is a level of granularity that we have not been able to publish before now. But our numbers are big enough now that we can publish it, and so I want to give you a little explanation of what that is. And that is, starting tomorrow, you will see on our test reporting it broken down by PCR and antigen. Right now, it's just PCR testing. Now, PCR, I will remind you, this is the gold standard. This is the traditional test that we've been doing since the very beginning of this. But more recently, the antigen tests have become more available. You might have heard this called the rapid test or the point of care test. These are all the same. These mean all the same things. They're formally called antigen testing. And the reason that you're seeing more of these now is because you will remember probably 6 or 8 weeks ago, the federal government began shipping testing machines to all nursing homes in our state. Those are all antigen point of care tests. Likewise, they've become commercially available, so many providers and clinics and hospitals have these rapid tests. And then also, most recently, you've heard me and the governor talk about the Binax Now test. These are also antigen or rapid point of care test. Let me explain the difference in these two tests. They're both good tests, but they're both a little bit different. So the PCR test is the gold standard, and it uses a process of what we call viral amplification, which, if you want to kind of be in layman's terms, it helps you search for that needle in the haystack. It takes really small pieces of virus and makes them bigger or amplifies them so the machine can pick them up. It's a longer, more laborious, and highly technical process, as opposed to the antigen test. The antigen test is probably more along the lines of what you're familiar with, one line or two lines, specifically as it relates to the Binax test, much faster, easier to administer, easier to read, and doesn't require the machinery or all of the sophistication and technicalities that the PCR testing does. I will tell you, though, that there is a trade-off there. The trade-off in being faster and more convenient is that antigen tests in general are a little bit less sensitive, which means they won't pick up as many positives as the PCR test, as the gold standard. But that's the trade-off that is appropriate in certain situations. And so, if you use my needle in the haystack on the PCR, this is more like scanning the haystack and seeing if you see a needle. It has to be a little bit bigger and it has to be a little bit more noticeable. But when you find it, you can result it as a positive, and it means just the same. But let me tell you, because of these differences in sensitivity and detection levels, the national reporting requirements, the standards for these are different. So PCR is the only kind of test that can be reported as a confirmed test. A positive antigen test has to be reported as a probable. Now, a lot of people who get an antigen test also get a PCR, and so if the PCR comes positive, they will ultimately be transferred to the confirmed category. But if they just have an antigen test and it's positive, they are considered a probable case. That is a national standard definition. That's not something we control locally. That's the way it's being reported in every state. You have probably noticed recently that our probable number has gone up dramatically in the last few weeks. And that's exactly what I was describing earlier about the recent proliferation or availability of these tests. This is what, by and large, nursing homes are using for screening. This is what a lot of clinics are using for rapid tests, and it's what the Binax Now test that are just starting to be rolled out are reported as. So if you have seen a recent increase in our probable numbers, it's because the national definition requires that antigen tests be reported as that. I will tell you that over 75% of all of the probable cases in our data set are from antigen tests. They're not people that are suspected to have it without a test so much as they are antigen tests that have to be reported as probable. So again, if those patients that have a possible, or excuse me, a probable case because of an antigen test, if they have a PCR test, they are converted to confirmed. But you will see that breakout tomorrow, and I think it will help you and your viewers and readers to know how to interpret that probable number a little bit better. I'm sure there will be questions later, and I'm happy to answer them.
Okay, thank you, Dr. Piercy. It should be noted Commissioner Schwinn's on the call as well. So if we have any questions related to education, she's available on the call as well. So we're happy to open it up for questions.
Thank you, Governor. First, we'll go to Natalie Allison with the Tennessean. Natalie, your line is open.
Good afternoon, Governor. How are you?
I'm well. Thank you, Natalie.
Good. So I want to ask you about the mask mandate. I know you've spoken about this at length, but more recently, 9 of Tennessee's 10 counties with the highest average positivity rates, ranging from 17 to 25%, do not require masks. So you're opposed to issuing a statewide mask mandate, but would you instead encourage the mayors in those counties with the most severe outbreaks to do that in this situation?
Yes, we are in contact with mayors on a regular basis. And in fact, we send our unified command group to counties that have particular challenges, and we encourage those mayors to use whatever tools they have necessary, including mask requirements for their communities. And those change a lot, as you know, those counties and their case counts change. But yeah, the short answer to that is yes.
You are urging those counties with the worst outbreaks to implement mask mandates, even while they're currently choosing not to do that so far.
That's right. I mean, we obviously, as I've said, we give them the authority to do so, but our team reaches out and asks them about the different strategies that they're taking across their communities, and we encourage them that if they believe that they should use that tool, then they should use it.
But I mean, it would appear that they don't believe they should if places like that haven't implemented that strategy and they have 24-25% positivity rate right now.
Yeah, so I had a call, in fact, this morning with the county mayor to discuss the idea of an implementation of a mask requirement in their county. So we have a lot of communication with mayors about the multiple ways that they can help mitigate the spread, and mask is one of them.
Okay. And then on the ad campaign, so this isn't the first ad campaign the state has released regarding masks and behaving responsibly with COVID. What is different about this one? That one didn't seem to convince people in rural parts of the state to voluntarily wear masks in public, and you're still facing this situation where people just don't want to do it. So what's different about this one?
You know, what we really hope, Natalie, first of all, as you know, there are a lot of tools. We're trying to build an infrastructure in the state, as we talked about, whether it's a response infrastructure, whether it's healthcare capacity, healthcare staffing, COVID nursing homes, and messaging. Messaging is very important to remind folks that they have a personal responsibility to engage in this. And that's the goal of PSA. We all know that messaging works, particularly, well, we all know that messaging works, and that messaging reminds people about the things that they can individually do. That's the goal of the PSA, is to remind folks, hey, you have choices to make, and Tennesseans have made a lot of good choices in this. And we want to continue to encourage those good choices. And one of them is, no matter what you're doing and where you're going, protect yourself and your neighbors by wearing a mask.
And then finally, when and how do you plan to vote? So are you planning to vote on the last day of early voting or election day?
No, I plan to vote. I plan to vote early as soon as I get out of quarantine.
Next, we'll go to Jonathan Matthijs with the AP. Jonathan, your line is open.
Hey, Governor. I wanted to see, are you ruled out for the debate on Thursday, or is there some chance that you still might be able to go to it due to quarantine? Or to, I think there's a fundraiser for President Trump on that Thursday. And if not, when are you, I guess, off the injured reserve or whatever it's called these days?
Yeah, I will. I'm following the advice of doctors and staying in quarantine, so I won't be attending any events on Thursday. And I think our quarantine runs out on Tuesday afternoon, if I'm not mistaken. So I plan to continue to test through this period, but not attend any events between now and Tuesday.
Okay. Do you plan on participating in any of the, if there is a Trump fundraiser, participating virtually in some way?
No, I don't have any plans to participate because I can't. I mean, I can't go to it.
Okay. Thank you.
Next, we'll go to Phil Williams with News Channel 5. Phil, your line is open.
Thank you. Governor, following up on Natalie's question, the new ad campaign emphasizes choice, which implies that Tennesseans also have a choice not to wear masks, which you have done yourself on occasions. Well, why not a stronger term? Why not a stronger push rather than a choice?
Well, I think that people will make choices. People have choices, and they're going to make choices based on their own individual decision making. So we want to encourage them to make responsible choices. We know they have the ability to make choices, but we just want to encourage responsible choices.
And if someone chooses not to wear a mask, do you think that is a legitimate choice as well?
Well, I think that it's not a responsible choice if they're in a situation where they can expose someone to the virus or be exposed themselves. So I think they, and we know that people are not going to be perfect in their choice. This is really about adopting a habit. We want folks to adopt a habit to wear a mask when they're in a situation that is compromising, to have a mask. There'll be times when they don't, or when they forget it, or where they take it off in a situation. But we want people to begin to adopt habits because this is going to be with us for some time. And to the degree that we can encourage people to adopt a new habit, and that'll help keep them safe and the people around them safe.
And a quick question here for Commissioner Pierce. The alternate care sites, which you mentioned last week, are for 9 ICU patients. What happens if we run out of ICU beds?
Yeah, that's a good question. ICU beds are, this may be counterintuitive to you, but it's actually fairly easy to convert regular beds or other procedural spaces in a hospital to an ICU bed. You typically start, and we have to do this sometimes in flu season. I say we, as a former hospital administrator. We will turn the recovery room into an expanded ICU. You can take a surgery center that already has the ventilators and the setup and the large rooms. You can turn that into an ICU. You can turn step-down units with the telemetry monitors into ICUs. You can even turn ER beds into an ICU. So it's a good question, and it's something that every hospital has a plan for, but that's something that almost always can be done in-house.
Thank you.
Next, we'll go to Chaz Fisk with WPLN. Chaz, your line is open.
Hi, Governor. A number of people out there, leaders or otherwise, after a couple of negative tests would have probably thought to themselves that a 14-day quarantine isn't really necessary. You've said that you are going to stay in quarantine for the duration. I mean, is there a message in that decision that you're trying to send to Tennesseans about taking this situation seriously?
Well, we do need to take it seriously. It's a very serious virus. We have people losing their lives to it every day in this state. We understand the seriousness, and I certainly do. And I want to. It's serious to me. So the reality is, and the science of this is that until 14 days, you still have the opportunity to begin to shed the virus. So you would be a threat to other people within that 14-day window, regardless of the amount of tests that you take. So every time you take a test, it gives you a little bit better understanding of where you are. You can find out if you're positive sooner. Therefore, you could consider, for example, what you're going to do about getting treatment. But the reality is that until 14 days has passed, you are still at risk for shedding the virus, which means that you're still at risk for giving the virus to somebody else. And I certainly don't want to. I don't want to be a risk to other people. And I do want to, to take it seriously and model taking it seriously and be responsible. That's what we're trying to communicate to folks: the seriousness of this, the importance of it, the personal engagement of people all across Tennessee, the responsible choices that they need to make. For me, it's a responsible choice to quarantine for 14 days.
And just a quick follow-up on that. I mean, there were, for the most part, you have worn your mask mostly in public. There were some pictures, though, out there on social media of you not wearing a mask at the lake and places like that. After this quarantine, is that something that you will no longer do in terms of?
I've tried to be real careful about that and wear a mask. It's interesting. For example, you're with some folks and somebody says they want to take a picture. You take your mask off for 10 seconds to take a picture. It doesn't constitute close contact. The risk there is not significant according to the CDC. So we have to be practical with this. That's part of how people will adhere to wearing a mask when they know that, hey, you know what? We have to do this in a way that makes sense and that works with people living their lives and moving forward. I do believe that we can continue to live our lives, but do so by making adjustments and developing new habits. And so wearing a mask is something I do every single day. Then when I make a decision, for example, to take my mask off for 10 or 15 seconds to take a picture, that might look like an irresponsible move, but I'm trying to be practical and I'm trying to model that for people to say, you can be safe, you can live your life, you can continue to move forward, and you can protect the people around you by making wise choices.
Okay. Thank you.
Next, we'll go to Allie Mason with WBBJ. Allie, your line is open.
Hi, guys. So I just had a question. So yesterday I did a story about reporting patient information for those who test for COVID-19. And we had a local doctor speak out against reporting patient information of those who test negative. I was just wondering if there could be any response to that or somebody could speak on that.
Dr. Pierce, do you have a comment about that?
Yes, sir. Thanks, Allie. Yeah, those are federal reporting requirements. Those come from HHS and or CMS. It's required federally that they're reporting both positive and negative results, and all of the details are pretty easy to find online. We saw that mention in your story, and we're just double checking to make sure our process is correct. But yeah, those are all federal reporting requirements. That's not coming from the state.
Okay. Thank you.
Governor, that's all the time we have today if you'd like to close.
Thank you all for joining, and thank you for your questions. Thank you for what you do to spread information to Tennesseans about this very serious situation that we find ourselves in and the efforts that we're making across the state. And I just want to remind all Tennesseans out there that we do have the opportunity you individually have an opportunity to help in the mitigation of the spread of virus in your community. And you can do so by making wise choices and by recognizing the seriousness of this and by implementing the tools that you have individually to make sure we do that. So we encourage Tennesseans in that way, and we appreciate the things that Tennesseans are doing. We are grateful for the partners that are working, the teachers that are out there, making certain that kids are in classrooms safely. We're grateful for the frontline healthcare workers that are out there daily doing the work that they're doing. We're grateful for every aspect with regard to how Tennesseans are engaging in this. And together, we can work together, work our way through this, navigate our way through it in a way that has the best outcomes possible. We appreciate everyone's participation in that. Thank you. We'll talk again.